Hi everyone. Today I felt a good topic to talk about was what I get asked a lot when I'm doing a number of consulting aspects of my work with various agencies. The thing that comes up a lot is the question that people want to know is why this relatively sudden rise or surge in functional, integrative, and naturopathic medicines. And just for simplicity, I'll just lump them all together under the same kind of holistic umbrella since there's a lot of similarities, particularly naturopathic medicine is kind of at the top, and then integrative medicine and functional medicine were born out of those. But there are a few reasons that it's so popular and becoming more and more popular, not only in the United States but worldwide. Because I have patients all over the world, and I'm hearing a lot of the same things. Is that one aspect is that people are sick and tired of being sick and tired, and at least in the United States medical system, it's very deft and well equipped for acute, emergent, and urgent care. Right, and essentially, if you have an acute crisis, you either survive or you die. So, what most people have in the industrialized world is complex chronic disease. And the way the United States system is designed, unfortunately, that insurance essentially dictates everything, that doctors are now having to see patients quicker in shorter amount of time, as well as medicine itself has become very compartmentalized. So what used to be back in the day where you saw your GP, your general practitioner, your primary care provider, is that they would manage just about everything using specialists as needed. They would also see you in the hospital. That doesn't happen anymore. Now we have these hospitalists that essentially take over that role when people are admitted into the hospital, particularly outside, say, the emergency room. So what happens is that when you have, 10 minutes to see someone, there is no way that you can manage all of those conditions effectively. Essentially, you can manage them by keeping them alive until the next visit and just tweak some medications. But to actually cure someone and help them resolve those complex chronic issues, it takes a lot of time, more time than the conventional medical model allows. And I'm not anti-conventional medicine. I prescribe medications all the time, as well as my residency I was right there in the emergency room, and I was with internal medicine residents and family medicine residents and outpatient clinics. And some of my best friends, are my colleagues, are medical doctors who are now more into functional medicine in their psychiatric practices or their family practice or their pain management, because they realize they want to be able to treat people. And my conventional brethren, they don't like the system. Their hands are tied. They are well aware that you can't really cure anybody in a 10-minute visit. So you need more time. You're basically just keeping them alive until the next visit with medication management. So that is one reason that there's such a rise in popularity of this holistic treatment, is because people like me take more time. We address more of the issues. We will handle much larger amounts of the problem list. So if someone has, autoimmune disease and they've got gut issues and they have, fatigue and insomnia, someone like me is going to handle all of them using medications as needed, but those are band-aids just to buy you some time. But we really got to get to the root cause. Where conventional medicine in chronic disease management, it's like, well, you have hypothyroidism, you have Hashimoto's, here's levothyroxine, and hopefully you respond and you're just left on it forever. But it's like, why does that person have hypothyroidism? Conventional medicine does not allow the time for that to be elucidated, nor the expansive workup that needs to be happened looking at, all of the thyroid hormones. But there's a constant crosstalk in the endocrine system. So it's not just, there's a reason there's the hypothalamic, pituitary, thyroid, adrenal, and gonadal axis. They're constantly talking to each other. When one's out of whack, they all tend to go out of whack. So to better treat someone, you got to address all of them. Another reason there's a rise in popularity is just sheer patient demand. So it's not necessarily that a lot of conventionally trained physicians want to deal with um, integrative or functional naturopathic medicines, is that patients are demanding it when they walk in the office. With the internet, with AI, all these other programs, these direct to consumer labs, patients are becoming more and more well informed, sometimes misinformed because the general public isn't trained in medicine, so they don't know what to believe, what not to believe, what's true, what's not true. A lot of snake oil out there, misinformation, disinformation, a lot of medical mediums and these other individuals, influencers who have no medical training or health background, but they're very popular online, and I see this a lot. And now I have to dispel the myths that no, not everybody has parasites, and that's not the root cause of your rheumatoid arthritis. Is it contributory? Possibly. Let's investigate that with subjective testing or objective testing and really find out. So the main reasons that, really why this has been such a rise is that people are really sick. Conventional medicine isn't really well equipped to handle chronic disease long term. It certainly can be helpful, and sometimes you need that integrative approach where you need, maybe a medication like a disease-modifying anti-rheumatic drug or some kind of biologic with the naturopathic support. So you can go on a lower dose, less side effects. But many times with naturopathic interventions, you don't need any of the medications, or you can wean them off medications or down to just one in a lower dose. And then obviously then subsequently overall quality of life has been improved. And this isn't just relegated to the United States. I see this again all over the world. I thought the United States healthcare system was broken, and then I start seeing people in the UK and the EU and Australia and Canada, and their systems are just as broken, just in different ways. So like I have patients in the United Kingdom or Canada, and they can't even get an ultrasound for 6 months, right? They're on a waiting list. I'm like, but this is really necessary. I mean, we really need to know, do you have PCOS or not? And they're like, well, my GP ordered one, but I can't get in because it's not urgent or emergent. It's 6 months wait. The advantage of some of these countries, though, is cost. So they can go to a private pay hospital and get it right away at a far cheaper price than you could in the United States when you're cash pay. So here we're kind of stuck in this conundrum, right? Where everything is super expensive, even out-of-pocket costs are super expensive, and then insurance premiums are higher, the copays are higher, and what they pay the doctor is lower. So, but yet these executives are all making hundreds and tens of millions of dollars, and so the insurance system really dictates a lot. But it's not just the United States. But the one reason the popularity, right, is that people just need the proper care so they can have improved quality of life versus just, a laundry list of pills. The specialists aren't talking to each other. The GP isn't coordinating everything with the specialist. And they're like, oh, that's your thyroid, you go to endocrinology. Oh, that's your gut, you go to gastro. It's become too compartmentalized. And I use specialists all the time. I'm like, well, I need to know if you've got ulcerative colitis or Crohn's. I need you to go get a colonoscopy, endoscopy. I don't do those. I need the gastroenterologist for their diagnostic prowess and their acumen to come back, so now I can better treat you because I know what's going on. So hopefully this helps understand why more and more people are looking into people like me to help cure them of their complex chronic diseases. But natural medicines can be used for acute care. Emergent care is different. Acute care, though, it's still well equipped to handle those. Thank you for listening.